Thank you, Julio Mayol, for joining us with the American College of Surgeons. We are providing resources for surgeons throughout the world, our core base in the United States, but obviously throughout the world, with information that is important to them to help take care of their patients and to protect themselves and their families. And it's a pleasure to have my dear friend, Dr. Julio Mayol, Professor of Surgery in Madrid. Julio, why don't you please let the audience know your functions there in Madrid?
Thank you very much, Steve. Right now, I'm Professor of Surgery at the Universidad Complutense de Madrid. And in addition to that, I serve as Chief Medical and Innovation Officer at Hospital Clínico San Carlos. This is a 900-bed university hospital in Madrid.
So you're really at one of the European ground zeros, which is why we're talking to you. And also, of course, you're worldwide renowned for communication through social media. Is very important at a time like this. And if time permitting, we'll get to that part of it shortly. But if we can start out talking about some of the impact of this pandemic in Madrid on your medical staff. Tell us a little bit about the precautions staff are taking, and despite those precautions, what's happening to your staff?
This is a major concern for us because it limits our ability to respond to this pandemic. So right now we get between 10 and 15% of our employees affected by COVID-19. And right now what we provide, in spite of the global shortage of PPEs, we provide surgeons who go into the OR to take care of patients with COVID-19. We provide them with PPEs consisting of facial screens, FPP2 and FPP3 masks, depending on the risk of aerosols in the OR, and all the equipment needed. And right now we have two separate circuits, one for COVID-19 positive patients and another one for COVID negative patients. The problem right now is that it is so frequent in the community that all emergency cases are treated as COVID-19 positive because we don't have the time to get a test on time to really decide whether this patient is positive or negative.
So what does that mean in terms of the PPE and in terms of any negative pressure operating rooms? If you presume everyone to be positive, is the entire operating room staff dressed in full PPE for every case? And
yes.
Are cases, so everyone has full PPE for every
emergency cases, for COVID-19 positive, and for emergency cases, all the staff is equipped with PPE.
Any emergency case?
Yes.
Okay, is the operation done in a negative pressure environment?
Negative is preferred. In case we don't have a negative pressure OR, we use neutral. But negative is preferred. Remember that this this virus can go out and it would be a disaster.
Sure, no, absolutely. So at what point in this pandemic were those precautions adopted? At the very beginning, or did it take a little while to sort it out?
Yeah, we were late. The measures were probably the European CDC announced that this was going to happen, but here in Spain, we didn't receive adequate information on time. So these measures were implemented 2 weeks ago. So we were late. This has to be implemented as soon as possible, as quick as possible. Otherwise, you go after the virus instead of going before it. So you are always late. That's a problem. That is a major problem for us. And we acknowledge that this happened, and this may be the cause of many surgeons and nurses infected because these measures were not implemented at the right time.
So you're talking about 10 to 15% of your staff that are COVID positive. What, give us an idea of how many are sick in hospital or in ICU as compared to isolated? And then
Yes,
where are
yes.
they isolated? Are they at home or do you provide some kind of housing?
We have different strategies. Right now, we have 23 healthcare professionals admitted to the hospital, two of them in the ICU. Um, and we are like 5,000 employees working at the hospital with 1,300 doctors. And what we do is when we suspect that they have been exposed to the virus, we try to test them as soon as possible so we can make decisions, but that's not enough. We need to control for a temperature to make sure that they don't develop temperature, fever, or coughing, and then they are sent home. The problem is when they go back home, they are frightened by the idea of exposing their families to the virus. So what we have done is to hire hotels for healthcare professionals where they can get adequate care, and there are COVID positive hotels for healthcare professionals and hotels, COVID-19 negative hotels for those who don't want to go back home and expose their families to the risk of contracting coronavirus.
So is everyone tested in both of those facilities to be sure they're positive and be sure they're negative?
Yeah, we are very aggressive now with that because that's a critical measure. We need to test as many people as possible. We have been fooled with quick testing. The Spanish government acquired some tests from the Chinese, and they didn't work. They were really inaccurate. So we are trying to set up a different model with different providers, so we can really assure that negative is really negative, because there were many false negative results. In addition to that, we are looking at immunology. We want to implement IgG and IgM testing to make sure that those professionals have developed immunity and they are safely sent back to the front line.
Speaking of precautions and treatments, have you been using any of the anti-malarial treatment or any of the plasma treatments that are spoken about in the literature?
Yeah, well, my hospital is it was the second hospital recruiting patients for the Solidarity trial promoted by the WHO. So last weekend, we started recruiting patients. We use chloroquine, that's one arm. There are two more arms with antiviral treatment plus interferon in different combinations. So we want to recruit as many patients as possible for the next couple of weeks to have something ready in 2-3 weeks later with better knowledge of the effects of these treatments that are already approved and that could be used almost immediately to treat patients. But chloroquine has been the most frequently used drug. The problem is that we run into a shortage because people were purchasing and buying chloroquine, and there was not enough treatment for people with other diseases that they need the treatment. So right now we have this Solidarity trial going, and we will have answers in the near future.
Okay, and then the last question I want to ask you is about the use of social media for disseminating information. People use the term social distancing. Mariana Barrow, who you know is our chief of pathology and lab medicine at Cleveland Clinic, Florida, chief wellness officer, prefers the term physical distancing. I think
Yes, that's more accurate, I think.
probably is more accurate. But with physical distancing, her statement is that it's even more important to have social interaction, and hence we have social media. Can you talk a little bit about the use of social media for dissemination of education, as well as just maintaining some normalcy of interpersonal relationships?
I totally agree. We use this for different purposes. First of all, to disseminate sound information. And I think that medical influencers must play a very important role here. We have something that we have this commitment to disseminate valid and high quality information, and we need to do that. Secondly, I use it to communicate with my employees and with people working in Madrid, just to keep them informed about the next steps we are taking. And thirdly, we use this with patients and with citizens. They need information. They need reliable information from people really in the front line or close to their relatives. So we are trying to put in place different strategies to provide good information, because information is key in a pandemic. And high quality information, reliable information is more important than ever before. And so I really try to use it for professional and also for personal relations, because this is key. We need to be together, physically distant, but socially together.
Yep, I think that's a very, very important message. Well, I thank you for your time. I know you're much sought after for interviews. I was very impressed with your Sky News interview.
Thank you.
And also, certainly the pearls of wisdom you've imparted in this one, hopefully will be of significant value to the fellows and members of the American College of Surgeons and others who hear and see what you have to say. So I'd like to again thank you for your time. I certainly, on behalf of the American College of Surgeons, wish you continued good health, continued safety for you and your family. And we look forward to seeing you in good health when this pandemic finally allows us to get back together in person. In the meantime, I'm sure we're going to have many more virtual interactions between now and then.
Stay safe. Stay safe.
Thank you. You too.